everyone, and welcome back to another insightful episode of Myths and Apps podcast series, where we bring you conversations that highlight real world challenges, inspiring healthcare journeys, and the people creating meaningful impact in medicine and the society. And today's topic is both deeply emotional and extremely important, from rescue to reunion, the journey of mental health rehabilitation in India. Across our country, many individuals living with severe mental illness are found wandering without identity, shelter, or access to care. But behind many of these stories are dedicated teams working tirelessly to rescue, rehabilitate, and reunite them with their families. And to discuss this important subject, we're joined by Dr. Prathamesh Hemnani, who is a consultant psychiatrist and associate psychiatrist at Shraddha Rehabilitation Foundation, an organization founded by Dr. Bharat Watwani that has helped reunite more than 12,500 wandering mentally ill destitute with their families across India. Doctor also runs a private psychiatry practice in Ulhasnagar and Kalyan with a strong focus on evidence-based and patient-centered psychiatric care. Doctor, thank you so much for joining us, and it's a pleasure to have you alongside us for this discussion today.
Likewise, you.
So, doctor, to begin with, could you help us understand what the term wandering mentally ill destitutes really mean in Indian context and how significant this issue is today?
Yeah. See, wandering mentally ill destitute basically is a person suffering from severe mental illness, uh, either before he went on in roads or after that. It's a bi-directional flow. Because of the mental illness, they were not able to gather their identity. They were not able to speak to people about themselves. And for example, a person from Bihar uh, went on to a train which was headed in any southern part of India and landed up there. Because of the language barrier, the cultural barrier, uh, he or she ended up with a mental illness, or maybe they had a mental illness prior to getting wandered out of the house. They end up in some other part of the country where there is no one to take care of them, and they end up in road. So you must have seen those disheveled, untidy people who carry loads of bags and just wander around the cities. Uh, if I'm about to comment on the magnitude, we don't have the exact numbers, but uh, as per the data, almost 50 to 60% of the roadside destitutes are suffering from mental illness. And like the data which was there till 2016, almost 1.8 million people were roadside destitute. So roughly almost you can count almost a million of them have mental illness. And these people are always suffering from severe mental illness like schizophrenia, bipolar disorder, schizoaffective disorders, dementia, severe depression with catatonia. And the treatment gap in India regarding mental illness is huge. Like statistics say there is almost 70 to 90% of treatment gap. Uh, Most of the psychiatrists are focused on are centered in the urban areas, the metro cities, and a huge chunk of population stays in the rural areas. And someone from that area gets a mental illness, uh, there was no treatment opportunity there, and then that person ended up on the roads. So this is the scenario which is right now we are facing in India.
But I think that's truly eye-opening, and thank you for sharing that, doctor. So now, doctor, could you walk us through the journey of a patient from the moment they are rescued to eventually being reunited with the family?
Before that, I'll just give you a brief of work what we do. Shraddha Rehabilitation Foundation was started in 1988 by Dr. Bharat Watwani and Dr. Smita Watwani, ma'am. Dr. Bharat, they both are the founding members. Dr. Bharat Watwani is the founding chief psychiatrist of Shraddha Rehabilitation Foundation. And the Karjat Center, Karjat is situated in small village. The center is situated in a small village called Karzat in Raigad district of Maharashtra. That came up in 2006. So since 2006, since the inception of the center till date, we have almost reunited 12,500. That was till the calendar year of December 2025. So I think as of today, the number has gone up to 13,000, roughly. I don't have the exact number as of today, but the exact number, if I'm able to tell you, just one second now, 12,587. And this was pan India with some international reunions.
Yes, I think that's incredible to know the impact also it is creating. That's really interesting, doctor. And also, I feel the process also sounds incredibly challenging, but at the end, it's very rewarding when you hear the numbers.
I think more than the numbers, it is what the emotions count. Now, the team
Mm.
is spearheaded by Dr. Bharat Vatwani sir and Dr. Smita Vatwani ma'am. But we have four trustees on board: Dr. Nilesh Matre, Dennis Matthew, and Dr. Rupa Tikchandani. And in the Kardat Center, we have associate psychiatrist, me, and my colleague, Dr. Swarali Ponvilkar. Dr. Swarali has been there since almost 5 years, and she's gone up till Bangladesh for certain reunions. And she explains that when the patient was missing for 21 years, the reunion journey was fantastic, but she ended up taking a camp there for the villagers, spreading awareness about mental health and treating them. She always carries, whoever from our team goes, they carry certain medications, emergency medications and psychiatric medications. If someone is in need, we can help them out. And she roughly saw some odd 60 patients that day in a remote village in Bangladesh. So this is the thing is, this is the main core team. But then we have almost at the Karzat Center, we have 20-25 nurses, we have residential medical officers. And the thing which stands out for this NGO is that there are a lot of NGOs working for the wandering mentally ill, for the roadside destitutes per se, who are not wandering, who are not mentally ill. But this is the only foundation in India which is comprising of a team of psychiatrists. Plus, we have almost 35 social workers from all over India. So, for example, if we have someone from Tamil Nadu, we get a referral from Tamil Nadu, and the patient, no one speaks Tamil here, but we have Tamil speaking social workers. So, the team comprises from almost different dialects, different languages, people who speak some certain languages. So, if someone comes from a remote village of Maharashtra, and the dialect is completely different from what normal Marathi is. A social worker comes up and he is able to recognize that because that's their work. That this dialect is from this Vidarbh, this basic, this belt, and then we are able to find more details about that person from that.
Yeah, that's very interesting, doctor. So, doctor, I'm sure like while these reunions are inspiring, the rescue and early treatment phases come with many practical and emotional difficulties. So, could you tell us what are some of the key challenges you and your team commonly face during this phase?
So these are the roadside wandering mentally ill roadside destitutes, which are basically rescued. So now we rescue them, either they are directly roadside pickups or
Mm.
police referrals, because the Mental Healthcare Act
Um,
2017 has a clause that if any mentally ill patient is found on the road, it is the responsibility of the police to rescue them and refer them to a nearby mental health care establishment, wherever it is. Then we have collaborated with 153 NGOs pan India who work on this issue. So we get referrals from these NGOs also and other state mental health authorities. Like for example, in State Mental Health Authority Maharashtra, we get referrals from Regional Mental Hospital Thane, Regional Mental Hospital Pune, Regional Mental Hospital Ratnagiri, and so on. These are the basically the referral uh, unit which works on. And the intervention is fourfold always. First is rescuing them, rescuing a roadside destitute and providing them with shelter and treatment. Now, the treatment per se is not, we directly don't start the psychiatric treatment because the person has been on roads for we don't know how much time. Firstly, the main challenge is medically. They are suffering from a lot of nutritional deficiencies. They are suffering from a lot of infections because the immunity has gone so low. We have a dedicated team there which caters to this. And then we gradually start the psychiatric treatment. Once the patient is better, the person develops rapport with the people there staying there, and they start gradually giving details of from which part of India they hail from, which is the nearest police station, which is the nearest railway station, and then our team of social workers get involved. Then we take the patient along with a social worker to the village, whatever village, wherever it is, from northeast till Kanyakumari, wherever it is. Uh, the main aim of taking the patient there is because we don't contact the family first. The message is clear. If a person who was mentally ill has been treated and is seen by the villagers and the family, the message clearly goes that mental illness is treatable. So that is the main aim. And then the social workers, the team, whoever goes with the patient, they spread awareness campaigns there. So this is the main approach which we follow.
Yeah, I think that's very interesting to know the approach also, doctor.
Yeah, this is the master chart which we have till from 2006 till December 2025. So if you can see the number here, this is the number we have reunited all over India and certain international reunions here.
Yeah, that's incredible. That's incredible, doctor, and the work that you have been doing over the years is really interesting and incredible, doctor. So now, doctor, before we conclude, what message would you like to share with healthcare professionals as well as the society at large to improve awareness, empathy, and support for individuals living with severe mental illness?
Firstly, I like to add, I'm the latest addition to this team. So the experience for me is negligible compared to what work Dr. Bharat Watwani, Dr. Smita Watwani, Dr. Swarali, and the other team members have been doing for over years. The message in general, it is that if this message goes to anyone, if you see any wandering mentally ill, the least you can do is, if you can't help them directly, just inform the local authority. So at least they are rescued and the treatment is started so that they get reunited with their family members as soon as possible. Uh, the stigma around mental illness is so much that people tend to fear that if the patient gets violent, what if hardly 1 to 2% of schizophrenics become violent. We have rescued so many people. Like, if we have rescued 100, only I'll say 3 or 4 people were there, patients were there who got violent. But after the support, when they come to know that ki हाँ, when we tell them कि घर लेके जाना है, घर का बताओ, कुछ खाने के लिए देंगे, the violence is turned towards a supportive system. They themselves come forward and they are humans. At last, they are humans. They also need shelter, they need support, they need to be reunited with the family members. So that is the last you can do. There are a lot of mental health podcasts, there are a lot of mental health talks, but I think the topic of wandering mentally ill is a topic which hasn't been addressed much on the social media platforms. So this needs to go out, that these patients need care. There are a proportion of people who are living off streets, who are suffering from mental illness, and it was not because of their will. They did not go on roads, they did not end up in the roads because they wanted to. It was because of a mental illness which landed them being a roadside destitute.
And I think that's really something that everybody as individuals can at least do for them and help them towards it. And that's
Even if
how
this message
a
reaches to
change will
someone,
happen.
and if someone has contacted the authorities,
Yes.
if they can contact us, they can contact any nearby NGOs who are working, or the police. And if the person gets rescued, it is a lot.
Correct.
Like for me, for the team, for everyone.
At least the first line of help is really necessary for them.
Definitely, yes.
Yeah. Thank you so much, Doctor, for sharing, such valuable insights and experiences with us today. And this conversation has been actually incredibly meaningful and severe as a reminder that mental health care is not only about treatment, but also about compassionate rehabilitation and human connection. So thank you so much for sharing that. And thank you to everyone watching and listening. We hope this episode encourages greater awareness and empathy towards mental health and psychiatric rehabilitation in India. And remember, if you're a healthcare professional who's eager to delve deeper into medical topics or have questions, do not hesitate to join us on the Medicine Apps platform. Medicine Apps platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay informed, stay compassionate, and we'll see you in the next episode. Thank you.